Hi, this is Dr. Machani. I'm an academic internal medicine physician. Today we'll talk about chest pain and how we evaluate. Chest pain has a broad differential diagnosis, including life-threatening conditions. The initial step in evaluating a patient with chest pain is to assess their ABCDEs: airway, breathing, circulation, disability, and exposure to determine if they are stable or unstable. Stabilize the patient, if necessary, before evaluating for life-threatening causes such as STEMI, cardiac tamponade, aortic dissection, pulmonary embolism, or tension pneumothorax. For a stable patient, begin with a focused history, physical examination, and an ECG to rule out life-threatening conditions. If the patient shows signs of critical illness, provide immediate management with continuous cardiac monitoring, pulse oximetry, IV access, and supplemental oxygen if hypoxemic. Check for acute coronary syndrome or ACS starting with STEMI. Look for localized ST elevations on the ECG or a new left bundle branch block, LBB, with acute coronary syndrome symptoms. If STEMI is ruled out, assess for other life-threatening conditions using clinical findings and the ECG. For cardiac tamponade, look for hypotension, jugular venous distension, and muffled heart sounds. Confirm with a transthoracic echocardiogram or TTE if suspected. For aortic dissection, identify tearing chest pain radiating to the back and vascular risk factors. Order a CT angiogram if stable or a transesophageal echocardiogram TEE if unstable. Suspect pulmonary embolism or PE in patients with sudden onset chest pain, dyspnea, hypoxia, cough, and hemoptysis. Calculate the Wells score and, if necessary, order a D-dimer test followed by a CT pulmonary angiogram or ventilation perfusion scan called VQ scan. For tension pneumothorax, look for sudden onset chest pain, dyspnea, hypotension, and tracheal deviation. Immediate needle decompression is required for diagnosis and treatment. Consider gastrointestinal causes like esophageal rupture in patients with chest pain after vomiting or esophageal instrumentation, confirmed with a chest X-ray or contrast esophagogram. After ruling out immediately life-threatening conditions, assess for potentially life-threatening conditions like non-ST elevation acute coronary syndrome, NSTE, ACS. STEMI is characterized by tissue damage due to occluding thrombus. Evaluate the ECG for signs of ischemia and order troponin test to distinguish between STEMI and unstable angina. Finally, consider less dangerous causes such as pericarditis, myocarditis, simple pneumothorax, pneumonia, and gastrointestinal issues like GERD and peptic ulcer disease. Thank you.